We're a really different animal than the Midshore Community Foundation. In fact, we were established to help the small organization, an individual or a group who had a charitable purpose, who wanted to go out there and do good work, but they didn't have $10,000 to set up a fund. And the other point was they weren't going to endow that fund, meaning that they weren't going to take all the money that they raised and put it away pretty much for eternity and only spend out the earnings, which would be roughly 5%. Currently there are 92 funds, but then we also, about 5 years ago now, we established a grant and evaluation office because we also saw that many nonprofits that didn't need to be part of our umbrella, part of a community foundation, really didn't have the grant writing expertise. And so we have partnered now with organizations like Talbot Hospice. We actually did some work with St. Martin's Ministries. So with other organizations, we're assisting them to diversify their funding base to go after some larger grants. I like to think of us as sort of the X factor, that we multiply whatever is out there. So we're very good at identifying needs and then finding resources to meet those needs, or collecting, a group of interested citizens, key stakeholders, to actually make a difference. Glenn Wilson, with the president of the United Way at the time, had come from a larger area, and he really wanted to just do an assessment and make sure that the United Way dollars that were donated were going for the maximum effect. So we looked at all of the other studies that had been done. Then we identified the areas where really there wasn't enough information to make a determination. And Glenn and the United Way board were really focused on finding where the unmet needs were. And transportation was the #1 issue. Whether it be transportation for medical issues, individuals who were elderly, who were isolated, just routine medical appointments, going grocery shopping, those kind of things. Yeah. And certainly some younger folks who didn't have a car to commute to work. There were tremendous number of potential solutions, but we aren't transportation experts. But we noticed that there was a grant. The Community Transportation Association of America provides technical assistance, both short-term and long-term. And so after the study was done and transportation was identified as a huge issue, and then people in Kent County rallied around the notion of let's do something to fix this, we applied under the United Way of Kent County's umbrella to receive that technical assistance. What I know is that they will be on site in Kent County. They've already reviewed any of the existing transportation surveys that are out there, and there's a new one that's been released. And then they're going to pull their resources and other plans that they have formulated for rural communities across the United States. Sure. There's some wonderful ideas out there. One of them was to partner with Washington College and provide sort of a college-led Uber service where college students who weren't in class could drive the vehicles and provide the transportation for those who didn't have them. Another idea is to pool of cars, and I think someone was looking at electric cars. And if we had several and then charging stations, someone could take a car, let's say, and drive to Dixon, Valve, or Lamont, leave the car there, then someone else who needed transportation home could take it, and there would be a local spot, maybe somewhere in Chestertown. So there are a lot of ideas, but putting it together, and most of the problems really relate to who's responsible, the insurance piece.
Because we also have a rural transportation nonprofit out of Cambridge.
Yes, we do.
Are they involved in this?
They are, absolutely. Santo Grande is a wonderful gentleman, and they're doing absolutely as much as they can. They started providing transportation for the disabled up in Dorchester County, and then over time, all of the local counties, Caroline, Talbot, Kent, ask them to expand that service. And so they are providing the medical transportation in many of those communities and a fixed route service. But it's difficult. There isn't enough money to meet the need. In Kent County, ridership is low. When they try to expand, usually there isn't enough, public awareness, so that, they've tried a few things that haven't worked, quite frankly. So I think we need some more innovative solutions. A large bus is probably not what we need. I'm realistic enough to know that we're not going to solve all the problems overnight, but that we can improve things. And with each step, you know, we get a little bit better, then we can tackle the next one. So what I do see in all of these rural communities is tremendous goodwill. A lot of people want to help, you know, and so sometimes it's just thinking out of the box. You know, how can we pool all of the vans that exist in Kent County, whether they be the hospital van or, you know, the vans for disabled or, you know, whatever, because often they're just sitting somewhere. So we just have to, you know, get people together and figure out that insurance piece. Yeah. And that's what we're hoping from this transportation study. The people who really understand all of the issues can take their expertise and give us some solutions.
Is there